Being diagnosed with diabetes can elicit a variety of emotions and anxieties. Looking at a recommended care checklist for patients with diabetes, you will find items such as regular visits with your primary care provider, a diabetes education visit, a visit with a dietitian, dilated diabetic eye exams, dental exams, diabetic foot exam, numerous types of lab work, and those are things I think of just off the top of my head. Navigating your way through this maze can be frustrating, it can be time-consuming, and it can seem so overwhelming. Often, it is so overwhelming that many areas get forgotten and just left off. Here at MCHC, we have an entire team ready to help you achieve your diabetes goals. I'm Mary Collins. I'm a doctorate-prepared advanced practice registered nurse or nurse practitioner. I am board certified in advanced diabetes management, and I'm a certified diabetes care and education specialist. As a diabetes specialist or diabetologist, I work alongside your primary care provider, but my focus is entirely on your diabetes. I work with patients of all ages, from pediatric to adult, and all types of diabetes. So whether you have prediabetes, type 1, type 2, ladies with gestational diabetes during pregnancy, or if you're having trouble with your blood glucose or blood sugar and you don't know what your diagnosis is, I can help you figure that diagnosis out, and we can find a treatment plan that works for you and is manageable by you. There are times you may be doing everything exactly as prescribed, but if it is not the right treatment regimen for you, it will never work. Sometimes standard treatment doesn't work for everyone. As a diabetes specialist, I'm able to use a wide variety of treatments to help with your difficult diabetes, and we will find what works for you. Diet and lifestyle modifications, medication therapies including oral medicines, non-insulin injections, insulins, diabetes technology that includes glucometers, continuous glucose meters, and insulin pumps. Those are things I use with my patients every day in practice. And although these are very important aspects of diabetes care, there are numerous other things that a diabetes specialist can help you with. These include healthy eating, timing of your medications along with your meals and your exercise or physical activity for optimal results, being active, problem solving, healthy coping, and reducing risks. Research shows us that diabetes is progressive in nature, and complications tend to worsen over time. They can cause you to miss out on both quantity of life and quality of life. However, the quicker we are able to either prevent or find and treat these complications, the better outcomes we see. Although managing diabetes is of utmost importance to your overall health, it doesn't have to be scary and it doesn't have to be overwhelming. I look forward to being part of your healthcare team and working with you to control your diabetes.
Hello, my name is Chastity Eversole. I'm a registered nurse and a licensed diabetes educator. I pursued diabetes education not only because of the great need in our area with the high rate of diabetes, but also because of my own personal experience with diabetes. I understand the importance of diabetes education as well as the problems and frustrations one may encounter. At age 35, I was diagnosed with diabetes. I wasn't offered diabetes education, referred to a diabetes specialist, or to see a dietitian. I had to research everything on my own. I was scared, mad, frustrated, and sad at the same time. Although a diabetes diagnosis can be scary, you don't have to go it alone. Diabetes education is about supporting people with diabetes and assisting them in setting small, achievable goals. It's not about telling you what to do or what you can't do, but how diabetes can fit into your lifestyle. By providing you the knowledge, it can help people with diabetes learn how to take the best care of themselves to prevent or delay complications. Diabetes education is a great tool for the newly diagnosed, whether it be type 1, type 2, gestational diabetes, or prediabetes. Also, annually to check your progress when beginning on insulin or other injectable meds, starting on continuous glucose monitoring, or for insulin pump support. The skills you learn will help you take better care of yourself. Diabetes education can assist patients in learning the skills to eat healthier, be more active, check blood sugar, know when you should check it and what the numbers mean, how and when to take medication, as well as common side effects to expect. Help solve problems and assist with goal setting, ways to cope with the emotional side of diabetes, reduce the risk of other health problems, continuous glucose monitoring options available, and keep you informed of the other diabetes resources. I've often found that as other things preventing patients from caring for themselves, whether it be they don't have the right supplies, have a medication they don't know how to use, can't afford the medication, or caring for others and putting themselves on the back burner, we can provide you with the assistance you may need. It is shown that people who have the knowledge and support to manage their diabetes are healthier than those who do not. Learning how to control diabetes will help reduce the number of emergency and hospital visits. Knowing how and when to take your medication, how to monitor your blood sugar, and how to take care of yourself helps you manage your diabetes better. Managing diabetes will help you avoid or delay serious health complications. Diabetes education pays off. That's because research shows people who have received diabetes education are more likely to use primary care and preventative visits and services, take medications as prescribed, control their blood glucose, blood pressure, and cholesterol levels, have lower health costs. Diabetes management starts with you, but we are here to help you along the way.
Many times people think I'm going to tell them foods that are good or bad for them, or foods they can or can't have. All foods can fit into a healthy diet. Monitoring their portion sizes is very important. People think all dietitians also create meal plans. Meal plans can be an unrealistic way of changing someone's diet long term. Rather than telling exactly what to eat, I'll offer guidelines for a healthy diet pertaining to your goals, ways to incorporate your favorite foods, and allow you to make informed choices that are realistic and maintainable. In regards to MCHC's diabetes team, a dietitian is only one team member available to help manage diabetes through diet. What, when, and how much you eat can make a huge difference in your ability to control your blood sugar when you're managing your diabetes. It's also important to see a diabetes educator who provides information for diabetes self-management, and seeing a provider specialized in diabetes who can help with medication management. To schedule an appointment, please call your nearest MCHC location. I'm available in person and telehealth visits.